stick your tongue right out for me. You do have slightly increased papillae, which is the little sort of hairy bits on the tongue there. I think some of the whiteness is almost a sign of the trauma that you've been doing to the tongue. And whilst a little bit of gentle tongue scraping is okay, I think you've probably been going over the top a little bit just because you're worried about, you know, the bad breath bit.
Jessica has been blaming her tongue for her bad breath, and in many cases tongues can be great health indicators. A pink, flat, shiny tongue can indicate iron deficiency. Black and hairy can be an overgrowth of bacteria, and a white cheesecake covering can be a sign of oral thrush. So if you're worried, don't bite your tongue, bring it up with your dentist. So if it's not the tongue, what is it? Bad breath can be a symptom of something far more serious.
Keeping really nice and still.
But James works his detective magic, and the answer is elementary.
And I think the really great thing is that overall, your mouth looks to be in good health. Now, when we're probing around the gums, if we've got some of that bleeding, that's a definite sign of inflammation. And before we think about any other causes for your bad breath, I want to eliminate that as a possibility first of all.
Jessica goes to a dental hygienist whose tools will get to the parts most toothbrushes cannot reach. Jessica's swollen gums have created pockets in which tartar and plaque have moved in. 70% of us do not brush our teeth for a full 2 minutes, so are more likely to have the same unwelcome bacteria who come in, make themselves at home, eat our food, and then defecate in our mouths. This, in effect, is the classic bad breath smell. 3 weeks later, she's back to see James.
Well, really what we do now is having a look to see how healthy the gums look from a sort of purely observational point of view. But now what I want to do is just have a little feel around the gums with our probe and just see really if we can stimulate any bleeding or anything like that, just with gentle probing. And compared to when I first saw you, when I was doing the little probing around your gums, there's a marked improvement in how much bleeding there is. There's a lot less. So it's a case of regular hygiene is keeping the plaque away, keeping the bacteria away, and your mouth's going to become more and more healthy, and I think you're going to feel more and more confident about how it's all going.
My confidence has improved, but I do need to keep coming to see the team, and then hopefully we'll get to 100%.
Bad breath can be caused by systemic problems such as liver, kidney or lung infections, but the main cause of bad breath in 99% of cases is going to be gum disease.
So don't let bacteria use your mouth as a loo. Always brush twice a day for 2 minutes. Top tips: parsley can take away the smell of bad breath, and sugar-free chewing gum can stimulate saliva. A moist mouth is less smelly than a dry one.